Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Leading NP expert Dr. Margaret Fitzgerald shares her knowledge and experience to help you dissect the anatomy of a test question, so you can better understand how to arrive at the correct test answer. So if you're ready, let's jump right in.
A 57-year-old man presents for a routine physical exam. During history taking, he reports that he drinks approximately 7 to 8 12-ounce beers nightly and denies other substance use, including tobacco. His physical examination is unremarkable except for mild pharyngeal erythema without exudate. In consideration of his health history, which of the following lab results would be anticipated? A, elevated platelets. B, macrocytosis. C, lymphocytosis. D, elevated sed rate. And the correct answer is B, macrocytosis. Let's address what kind of a question this is. Given we're provided with a health history, then asked about possible lab results. This is an assessment question focused on gathering clinical data. First, some background information. We're given relatively little information about this patient, with the exception of his alcohol use. By the way, keep this in mind, there is a specific, quote, serving or drink of alcohol that has been defined by many sources. And this would be 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof alcohol, such as whiskey, rum, vodka, or the like. In other words, those are all considered equivalent. In other words, he's taking in 7 to 8 servings, if you will, of alcohol per day. How would this patient's drinking pattern be classified? And the CDC provides the following guidance. An current infrequent drinker would be a person who has 1 to 11 drinks in the past year. A current light drinker would be a person who has at least 12 drinks in the past year, but 3 or fewer drinks per week on average in the past year. Current moderate drinker, that's more than 3 drinks, but no more than 7 drinks per week for a woman, and more than 3 drinks, but no more than 14 drinks per week for a man on average in the past year. Current heavier drinkers are more than 7 drinks per week for women, more than 14 drinks per week for men on average in the past year. Keep in mind, regardless of the number of drinks a person imbibes in, asking about and documenting the amount of number of drinks in a single day is important. And how is a heavy drinking day defined? For females, it's having 4 or more drinks in a single day in the past year. For males, it's 5 or more drinks in a single day in the past year. Therefore, this patient is classified as a heavier drinker with 5 or more drinks on a daily basis. Certainly, more information needs to be gathered about his alcohol use, but let's switch our attention to the focus of the question. What lab findings would be noted in the majority of individuals who drink heavily on a daily basis? And let me make one other comment. What you'll notice is the threshold for alcohol consumption, female, is significantly lower than it is for males. And the reason for that is, even if I had 2 adults standing in front of me, both 150 pounds, both healthy BMI, both the exact same age, everything of them is the same, except for one is male and one is female. The male has a bigger liver, the male has bigger kidneys. So they get rid of alcohol far more easily than females do. One more time, back to the lab findings. Macrocytosis is defined as having a mean corpuscle volume, an MCV, part of the RBC indices of greater than 99. And when it's associated with excessive alcohol use, this is usually noted in the absence of anemia. The threshold to develop alcohol-induced macrocytosis is 5 or more drinks per day for males, 3 or more drinks per day for females. Will all adults who drink alcohol at that level develop the mild macrocytosis with an MCV topping out at about 108? No, but about 60% of heavy drinkers will. So the majority will. The etiology is not fully understood, but is likely related to alcohol-induced nutritional deficiencies, as well as the effect of alcohol on the developing red blood cell and the bone marrow. Usually, the individual will also have other findings consistent with excessive alcohol use, such as mild pharyngeal erythema without exudate. And that's largely from the irritating effects of heavy drinking. Interestingly, part of it is because of the irritating effects, obviously, of the alcohol going over the oropharynx, but the other part is from exhaling alcohol through the breath. Both of those contribute to the redness. Reports of sleep disturbance are very common. At the same time, the pharyngeal erythema and the sleep disturbance, while common in people who drink heavily, they're certainly not specific to this condition. With this background in mind, let's take another look at the question. A 57-year-old man presents for a routine physical exam. During history taking, he reports that he drinks approximately 7 to 8 12-ounce beers nightly and denies other substance use, including tobacco. His physical exam is unremarkable, except for mild pharyngeal erythema without exudate. In consideration of his health history, which of the following laboratory results would be anticipated? A, elevated platelet. This is incorrect. Platelet counts can become depressed, also known as thrombocytopenia, an advanced liver disease associated with alcohol use disorder. Particularly low platelets is really common in individuals with cirrhosis. At the same time, thrombocytosis, an elevation in platelet counts, is not a common finding with heavy alcohol use. B, macrocytosis. This is, of course, the correct answer for the aforementioned reasons. Something to keep in mind, when alcohol use is curtailed or severely cut back, this macrocytosis, usually noted without anemia, will resolve in about 3 to 4 months as the new normocytic red blood cells, in other words, those red blood cells not exposed to excessive alcohol, will replace the older senescing red blood cells that are near the end of their roughly 90-day lifespan. C, lymphocytosis. This is also incorrect. An increase in lymphocytes, also known as lymphocytosis, is a common response to many, but certainly not all viral infections. Lymphopenia is occasionally noted in advanced disease associated with excessive alcohol use. So just to recap here, cytosis, when it's added to the end of a blood cell, means the number of those cells went up. Lymphocytosis would mean an increase in the number of lymphocytes. And when you add penia to the end of the name of a blood cell, like lymphopenia, that means the number of those cells went down. D, elevated erythrocyte sedimentation rate. An elevated erythrocyte sedimentation rate, aka SED rate, is a test of generalized inflammation and is not a specific finding in alcohol use. Key takeaways: the ability to anticipate and interpret lab findings in common health challenges such as alcohol use disorder is critical to clinical practice. And given that the boards are a test of entry-level NP practice competency, this knowledge is important to certification success. In a future podcast, I'll go over hepatic findings in alcohol use disorder.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.